This is a video that my friend recorded. She is my thermography technician, so she did my thermography. And if you watch the other video, you can see it right here on my YouTube channel. I shared my thermography results with everybody because I thought it was very interesting, and you could pick up a lot of different tidbits from it, even just different case studies from the different patients she's had in her past. So this little video is really to explain the who, what, when, where, why, how of thermography. It's extremely interesting. It's a webinar that my friend Shanna did a presentation with a doctor that was in Tampa. And three of the really big things that stuck out with me, and I mean, everything was really, really important, but three really big things that caught my attention were: the first one is 80% of breast cancer patients have no history. So they have no family history of breast cancer. This is 80% of patients. Breast cancer is the leading cause of death for women ages 35 to 54, but we're not recommended to have mammograms until the age of 40. So that's unless we have a family history, but if 80% of the breast cancer patients don't have a family history, you can see where that's a problem, right? Then the other piece of this is that 20% of mammograms give false negatives. So thermography has a different technology that gives a thermographic image of your entire body, especially your breast health, and it shows your vascular patterns. So you can see if you have some kind of inflammation going on before there's an actual problem. So watch the video. It's my friend Shanna who is doing the video at the webinar, and she has tons and tons of great tips in there on how you can make some changes too. So I hope you enjoy.
Okay, thank you for joining me today, Bradley. I have Bradley Aubrey on this webinar right now, and we're going to talk about medical thermography. Welcome.
Thank you.
You're welcome. Bradley Aubrey, he's also known as Dr. Wellness. He has his own clinic. It's called MediWell Clinic out in Tampa. And today I have an online presentation to show him that typically I show to a group of patients at a practitioner's office. So perhaps we'll be doing one live at your office someday soon there, Bradley.
Okay, sounds like a plan.
Yeah. So for everybody's knowledge, Bradley's MediWell Clinic is located on 8309 Gun Highway in Tampa, Florida. And also his website is mediwellclinic.com. If you want to, you guys should go check that out. All right, so today we're going to talk about medical thermography. My name is Shanna Schulze. I'm a certified thermographic technician, and I'm also a trainer. I'm a trainer for PACT. PACT is the Professional Academy of Clinical Thermology, and they train all of our physicians and also our thermographers on how to either compose reports or how to take images of medical thermography. So I'm a member of Breast Thermography International, and by being a member, I'm able to be listed on their website. It's a patient website, so people can go and make an inquiry from specific locations throughout the world, which it's a wonderful website. And also once a month, all of our members get together on a mastermind meeting. So we discuss, new case studies and marketing and so forth.
Oh, great.
Yeah. All right, so today we're going to talk about medical thermography, early cancer detection, and prevention. Thermography is actually ideal for prevention. You want to follow your report recommendations once you get your report back. It's kind of like using it as your health checklist. So for yourself, Bradley, or for any of your clients or patients, you can see areas that they need to improve on thermographically. So any signs of inflammation or even hypothermia, cold spots, can use some improvement. And basically what you would want to do is review the report with them and then either give them some additional tests to see what may be causing those abnormal findings or treatments to help them improve thermographically and also improve their overall health.
Okay, nice.
I always tell patients to take one thing at a time. They're going to review the report with me right after, and I kind of help them to realize what areas they need to focus on and address first. Some things are more urgent than others. And the idea is to improve any areas of inflammation, which could be the precursors to cancer and other diseases. Here's a nice long list about why I'm passionate about medical thermography. I've seen it time and time again where early detection saves lives. I actually have a friend who's, asked me, what are you doing today? And I'm like, oh, saving some more lives, because I literally do that with every time somebody gets a report back. Usually they make some improvements in their health, and you never know how that can change their future health. So in these next few slides, I'm going to show you why it's so important to screen yourself safely at least once a year. These are some startling facts out there. 1 in 8 women will develop breast cancer in the U.S. There's 290,000 cases every year. Breast cancer is the leading cause of death from women ages 35 to 54. And I don't know if you know, but they actually don't make a woman get a mammogram until age 40 because they say that young women with denser breast tissue, it does more harm than good. And it doesn't even make sense if it's the leading cause of death, ages 35 to 54, waiting till 40. Right now, there's over 1 million cases undetected in the U.S. There's actually 1 in 1,000 men will develop breast cancer. It's not just women that get it. There's about 40,000 women that die every year of breast cancer. 10% of all cancers affect women under 40. There's $15 billion spent in breast cancer research every year, and unfortunately it's not getting any better. 80% of breast cancer patients have no family history, and between 15 and 25% of breast cancer cases are overdiagnosed, meaning that women are unnecessarily getting surgeries, biopsies, lumpectomies, and even mastectomies. So to put all of that in perspective, here's a team of 24 women, of which 3 statistically would get breast cancer. You think about all these deaths throughout history, most recently there was 3,000 deaths in the World Trade Center. Every year there's 26,000 auto accident deaths, and 40,000 women die of breast cancer every year. So what do we do after 9/11? We beefed up security, spent $60 billion on TSA because of 3,000 deaths. There's 26,000 deaths every year. I certainly wear my seatbelt. I hope you do too.
Definitely.
Good. And with breast cancer, there's 40,000 deaths every year, and there's no available testing. That's the standard form of care for women under 40. So I have a question. What exactly is cancer? Don't worry, I'll just tell you. It's actually the uncontrolled proliferation of cells in our bodies. And cancer cells are actually in everybody, but normally they're kept in check by our immune system. So I know at MediWell Clinic, you must work really hard to help people, be well now and prevent issues in the future.
Right.
This is how we can see hotspots on thermography. Some hotspots are greater than others, and they could be cancerous. So there's no way to know for sure unless they go for further testing. But what's wonderful about thermography is that it could be early detection, that you could find a hotspot 8 to 10 years before it would actually show up on anatomical testing in some cases. So when these precancerous cells in our body, they go through this process called angioneogenesis. It's because the immune system is down and those precancerous cells are able to grab onto a blood supply, feed off that blood supply, and then they double on average every 90 days. So that's why with thermography, when you come in, and we see an abnormal hotspot, that sometimes our interpreting doctors say, wow, that looks, pretty concerning, go get an ultrasound right away. But if not, sometimes they want people to come back in 3 or 6 months to check out a hotspot because it could be one of 3 things. It could be tumor growth or angioneogenesis, or it could be hormonal imbalances, or, it could be toxins in the body. Do you have different things at your clinic that help to get rid of hormone imbalances or toxins in the body?
Yeah, correct. Yeah, we hormones and obviously detoxes and increase or lower the peroxidation.
Good. Good. Yeah, that's everything that I would recommend. I'm not a physician, I'm a technician, so once I get my reports back, I have to recommend my patients to, practitioners such as yourself, so they can go and work with practitioners and be working under a practitioner to really help to balance out the hormones and detox the body. So the medical thermography is based on many scientific studies. I have a few of them in this presentation. This one was conducted by Dr. William Hobbins. He's an MD at the University of Wisconsin Medical Center, and he concluded that thermography had 10 times the yield as compared to family history of breast cancer. So it's 10 times more reliable than saying, oh, should I get checked out because someone in my family had it, yes or no. Then mammography and resulting biopsy was actually positive as much as 8 to 10 years later in the exact area that the thermogram predicted that cancer might be present. So that's because of that fact, I always encourage my patients, work really hard and listen to these recommendations in your report, because you want to improve your health now so you don't have a problem down the road. And right now we have this gold standard of mammograms out there. Mammograms emit iodizing radiation. They can be painful. I've been told it's like applying 50 pounds of pressure on the breast. And whenever I talk to men about thermography, I always say, if there was a test that applied 50 pounds of pressure to the testicles, they'd probably come up with a different way, wouldn't they? But the breast tissue is very sensitive. So personally, I've never had a mammogram, and I don't think I'll ever get one, but I can't even imagine that much pressure. So then with mammograms, 80% of biopsies come back negative. So 80% of the time it's unnecessary to cut into a woman's breast tissue, which if there was cancer present, you run the risk of spreading it. 20% of the time they're false negatives, meaning 20% of the time women get mammograms and then they say they're fine and really they do have cancer. Mammogram guidelines are currently being challenged at this time because they're saying it's too much radiation for women under 40. And so now they're saying it's debatable in their 40s, and they're thinking of moving it to age 50. Here's a study. I'm sure you've heard of Harvard, right, out in Massachusetts. So at Harvard, they had this case. This is where we came up with that fact you saw earlier. Between 15 and 25% of breast cancer cases are overdiagnosed. Now, this is an extreme picture, of course, but with conventional testing, we said it could be 8 to 10 years early. It's like the anatomical approach looks for lumps or bumps, an MRI, ultrasound, X-ray, and there's all this time period where a cancer could be growing. It could take 8 to 10 years to show up on an anatomical test as a lump or a bump, but you could see it beforehand in thermography and then make some positive changes for your health and avoid it turning into cancer in the future. Here's an interesting article from the Canadian Task Force. They're kind of like the AMA of Canada, and they said that they'd rather see women ages 50 to 74 receive mammography every 2 to 3 years rather than annually, and not even screen women ages 40 to 49 at all. Listed in the British Medical Journal, it says, since the benefit achieved is marginal, the harm caused is substantial, and the costs incurred are enormous, we suggest that public funding for breast cancer screening in any age group is not justifiable. So it's not just in America that, medical journals are publishing articles about mammography and, the potential harmful effects. Here's a report from an MD in Manhattan. One of our patients brought this in, and it says right on the report that between 10 to 15% of cancers are not identified on mammography. And if you go right to the Susan G. Komen website, it actually says that mammography is 83% accurate, whereas breast thermography is 97% accurate, and I'll show you a study here in just a second, but it looks at the physiology or the heat in your body instead of the anatomy, looking at lumps or bumps. And it can detect cells that aren't dense enough to show up on an X-ray or a mammogram. That could be 10 years before a mammogram with no radiation, and it's actually safe at any age. I do full body imaging, and we'll get into that in just a little bit, but my youngest patient's actually 3, and my oldest patient is 94. So it's ideal for anyone who can pose for a camera, that is. This says, is this new? And no, this certainly is not new. Here's early thermography. You can see they used this technology that was similar to that of a mood ring. They actually pressed it right on the breast, and then with this very sophisticated piece of equipment here down in the lower left, it's actually a Polaroid camera. They took a picture of it and sent off those images to the team of interpreting doctors.
So that the healthcare system has not incorporated this as their normal form of testing yet?
Not yet, but it took mammography 25 years to become the standard form of testing and covered by insurance. So I'm sure it's just going to be a matter of time.
Gotcha.
But ultimately, I would imagine that the multi-billion-dollar cancer and pharmaceutical industries, they don't want to hurry this screening along because hopefully it'll prevent everyone from getting cancer.
Definitely.
There's over 800 articles out there that have been published on breast cancer and thermography, and thousands more on the rest of the body. But here's one of the greatest articles as of late. It was published in the American Journal of Surgery, conducted by this team of MDs, and published, performed at the New York Presbyterian Hospital and Cornell. And they concluded that thermography for breast cancer detection is 97% sensitive. So 97% sensitive or accurate, whereas mammography is only 83% accurate. Have you ever heard of Dr. Christine Northrup?
Yeah, she's awesome.
She is, and she's a huge proponent for thermography. She likes to call it October Breast Health Awareness Month rather than Breast Cancer Awareness Month. And I try to copy her on some things, but she says, I understand that mammography has been the gold standard for years. Doctors are most familiar with this test, and many believe that a mammogram is the best test for detecting breast cancer early, but it's not. Studies show that a thermogram identifies precancerous or cancerous cells earlier and produces unambiguous results, which cuts down on additional testing, and it doesn't hurt the body. Isn't that what women really want? So it's not just here, it's in 1,500 hospitals in Japan. Brazil has a great system. They use both thermography and anatomical testing before cutting into the breasts for detection. It's offered in Germany, ages 20 to 85, and research is currently being done at Harvard, Johns Hopkins, MD Anderson, UCLA, and more. So now we are getting into some of these case studies. Some will show you that thermal imaging is not just for the breasts, but I am a member of Breast Thermography International, so we do tend to market a lot to women, as an adjunctive to mammography. So they're going to show you that early detection and prevention are key to a long and healthy life. This first one here, this shows the importance of a 6-month follow-up. The image on the top, you can see on the left breast how there's like a little bit of yellow and then a red line. And then you can see 6 months later how much that increased.
Oh, wow, yeah.
Yeah, and we take a temperature reading, and it was at 1.86 from the right to the left side, and then 6 months later it jumped up to 3.51. So unfortunately that was definitely breast cancer, but when women first come in, our standard is 2 degrees Celsius. So typically we don't say go for an ultrasound unless it's above that. So they may or may not have told her to do that initially.
So with that being the finding from that one, you guys do it now, or in the sense of when it's at 2.8, like when it's not at a, you said at a certain degree, this is when you guys go and suggest them to get ultrasound done, right?
Right. So definitely at her 6-month follow-up, we would have said that an ultrasound is recommended on the left breast.
On the one on the bottom, right?
Correct. Yeah. Yeah. And this wasn't my patient, so I'm not sure if they recommended it at the initial one or not. They may have, because it was close to 2 degrees Celsius and quite the difference between the left and the right breasts.
Definitely.
Mm-hmm. So this is a picture of inflammatory breast cancer, which you can't even detect on a mammogram. And here's one of our patients. She came in initially in February 2012, and you can see above the right breast just a little bit of yellow. She came back 3 months later, and this is one of the breast cancers that can be very fast in progression. So you can see how it was yellow and then red. And at this point, they said you need to see a breast specialist, and I don't think the patient did until she came back and saw her thermography again in July. And you can see how the breast just completely changed in size, and it's metastasized throughout the breast. And unfortunately, she did pass away in January of 2013 from breast cancer. But had she taken her report seriously and taken some serious action back in May, she may still be with us. So it's definitely not something you want to ignore. Not too long ago, I had a patient who looked like she did in February 2012, and she said, all right, I'm all set on booking my 3-month follow-up with you. I'm just going to hold off for now. And I had just heard about this patient, so my heart really went out to her, and I got our interpreting doctor involved, trying to convince her to come back for a follow-up test, and for whatever reason, she didn't do it, so I'm not sure how she's doing at this point, but...
Normally it's once a year that they should get their mammograph, but if you guys see that it could be a possibility, then it's every 3 months.
Yeah, exactly. If there are any abnormal findings, we'll say come back in 3 months, or sometimes they're mildly abnormal, so then we'll say come back in 6 months. If everything looks normal, then we say come back in a year. So this is an interesting case. This woman knew she had breast cancer above her left nipple when she came in, and she was trying to decide whether or not to get a lumpectomy or a mastectomy. Can you see my mouse when I hover over her? Yeah. Okay. So see this area right here, these are the lymph nodes. And the surgeon eventually, the patient didn't want a mastectomy, so the surgeon decided to do a lumpectomy right here, and she also removed 11 lymph nodes right here. Can you guess how many of the 11 that she removed were malignant or cancerous?
The majority of them?
No, it's actually 2. You can see them right here. 1, 2. The thermography correctly identified the 2 malignant lymph nodes.
Nice. Wow.
Mm-hmm.
That's pretty precise.
I know. Yeah, so she could have just removed those 2, but I guess as a precaution, they removed all of them.
Okay, gotcha.
Here's a case of melanoma on the back that to the naked eye, it just looked like a small vascular pattern. And this woman actually came in for a breast scan, but the technician talked her into a health screening, which is the upper half of the body, except the arms. So, we found this melanoma on her. Here is lymphoma on the neck comparing to a PET scan. So you can see, without having to inject yourself with any sugar solution, the same, if not more valuable information with a thermography that also costs less. So let me skip this slide for a second. So the same gentleman, he developed a squamous cell carcinoma because of the radiation treatment on the lymphoma on the opposite side. And then his wife actually found an Indian remedy that they were trying. After the radiation, they wanted to go natural. And you can see it was actually working. This is October 2010, November, and December. You can see how much that heat diminished on his neck. But this poor guy, unfortunately, he actually ended up passing away from a stroke because that treatment, it was somehow blocking the carotid artery on the right side of his neck. And you can see this is one of the most important screenings we do is it's called the cerebrovascular screening. And what the interpreting doctors do is they take a temperature reading on the forehead from the right to the left side. And I've never seen anybody but him have black on their forehead. It was because he wasn't getting any blood flow at all to the right side of his forehead, which the branches of your supraorbital artery on the forehead connect to the internal carotid arteries.
What kind of treatment was he doing?
It was I want to say it was called either Indian 4 feathers or Indian 2 feathers to get rid of that squamous cell carcinoma in his neck. But unfortunately, that treatment also, I don't know if it ate away at his carotid artery or blocked it, but it caused him to actually pass away of a stroke after all that cancer that he had. This is a hot flash. The image that we see on the right is a woman having a hot flash. I've had, 2 or 3 women who I've been imaging tell me they were having them. So basically you have to stop what we're doing, have them cool off for like 10 minutes, and then we can do the imaging again. You can see intestinal inflammation in the abdomen. Sometimes there's inflammation over the liver, the gallbladder, the spleen. And if patients are showing any of that, we let them know they need to talk to their physician, figure out what they can do to improve their health of underlying organs. This one's a deep vein thrombosis. This woman came in just for a breast scan as well, and one of our interpreting doctors saw this darker vascular pattern coming up from the stomach, and they said, you know what, come see me next week for a full body, and saw this, unfortunately, the portal vein hypertension or deep vein thrombosis. It's what a toe fracture can look like. One of our technicians had a toe fracture. Cancer of the spine. This one was thyroid disease detected early. Sometimes on the limbs, you'll see some cold fingers. It could be the person's diabetic, or it could be compression in the spine, just different nerve issues, whatever's going on that's not normal, and they would need to talk to their physician about it. Then this is one of my patients. He had a really, prominent vascular pattern in the leg, so they recommend an ultrasound to make sure it's not deep vein thrombosis. This one's really common, is oral hyperthermia around the mouth. If you have excess bacteria around the mouth or in the mouth, it causes inflammation, and then that can also cause lymphatic congestion in the neck, which is pretty chronic in most of my patients, because it's just a matter of everybody should be brushing and flossing after every meal. And even, I don't know, have you ever heard of oil pulling? I recently started doing that.
What is it called?
Oil pulling?
No, I've never heard of that, no.
Yeah, it's basically you can swish organic coconut oil in your mouth, and you can put in other therapeutic grade essential oils with it, and it's supposed to pull out the toxins, and then you do that for 20 minutes and then spit it in the trash. And I've heard one of my patients, she went to her hygienist recently after going to her for 12 years, and she asked her what she had been doing, and she told her oil pulling, and she noticed a drastic improvement. And she also told her that a few other patients who made a lot of improvements said they were doing the same thing. This woman, you can actually see her tooth infection. There's a white arrow pointing to it. And then you can also see how the bacteria from that infection is draining right down into the neck right here. This one's a more normal, abnormal finding of the forehead, the cerebrovascular screening. We consider anything at 0.3 degrees or above to be abnormal. So for this person, they would say, definitely go for further testing with your physician for your carotid arteries. It also could be due to trauma in the head, scar tissue, or eczema, but whatever it is, it should be investigated further. Some more pictures of the hands and the feet, different abnormal heat findings that could talk to your primary care physician about, or a chiropractor. Sometimes red nail beds could indicate there's too much yeast in the body. These are actually my images. When I first started with the company, I had a SAD diet, the standard American diet. And I made a lot of changes throughout a year, and you can see how all these darker vascular patterns all but diminished. I still have some spots here, and that's signs of hormonal imbalance. So I'm still working with my physician to balance those out. And then here are the same images, but we have both reverse grayscale, which really shows the vascular patterns, and rainbow palette. And also I had some inflammation over the liver that went away after changing my diet, getting rid of sugar, dairy, and gluten, and working out more, doing some detox programs. I also did a food ALCAT sensitivity testing to see what I might be sensitive to. My oral inflammation went away. You can see how hot it was over there, and that diminished. Still working on that. Although in my follow-up, I probably had a headache, because you can see how this is much hotter, and my overall forehead and my neck. But what's important is they look for where symmetric, so you shouldn't have, you know, a hot spot over here and a cold spot over here.
Okay.
Here's one of my case studies from last year. She also showed some improvements after making some changes to her diet and working out more. You can see how her vascular patterns decreased. And she wrote this little, you know, testimonial saying she was surprised that she felt good during the diet without all the processed foods and sugars. I was like, of course, that makes sense. I always talk to my patients about eliminating toxins in their body. They can get a saliva hormone test, an ALCAT food sensitivity test, figure out what products they're using in their house. Do they have harmful toxic chemicals? Can they be replaced with, I like to use Young Living essential oils. They have a whole product line with, you know, cleaning products, personal products that are actually beneficial to the body rather than harmful. And then after, I can, if you want to send me, or actually you could give Gina some of your business cards and brochures. I'll see if she can stop by, and then we can put you in our referral book. So when we get our reports back, we go over these reports with our patients, then we can have your information to send to them, you know, so you can help them to improve their health and improve their follow-up scan.
Definitely. Thank you. I appreciate it.
You're welcome. I recently did a presentation for a group of Young Living people, so I put this in here. They encourage people to use a bottle at least once a year for a month of lavender and frankincense to help to prevent cancer. And there's Gary Young, he's the founder. And I actually just went to their convention out in Utah, so I took a picture of the lavender fields because it's just beautiful. I had to show you guys.
Nice.
So what to expect after at your screening. There's some online forms you need to fill out. Arrive 10 minutes early so you can cool down and acclimate in the waiting room. There's protocols that start 24 hours before your screening that you have to follow. They're listed on our online forms. And with us, you'll get a confirmation email after, you know, talking about those online forms. There's going to be a certified thermographic technician who will explain acclimation. And imaging can be 10 to 30 minutes. It just depends on which screening you get. After, you're going to have your report emailed to you. It'll take 7 to 10 days unless you want to pay a stat fee of $35 to get that back in 2 business days. And then you'll have to schedule your phone report review, and we'll go over that report with you. So with over 20,000 cases of cancer each year for women under the age of 40, young women with cancer are less likely to survive. So that's why we want to encourage people of all ages to get thermography, because there's no screening for this age group. And prevention or early detection at any age is ideal. I would say by now that you agree that early detection saves lives. So I ask that everybody thinks about their priorities, you know, going out to dinner, hair, nails, vacations. We learned that the average New Yorker spends $1,500 a year in Starbucks coffee.
Wow.
I know. So by watching this this presentation today, I'm offering $50 off for a thermography screening, and you would just have to mention that you saw this presentation, and then we would extend that discount for you. So thank you so much, Bradley, for listening to my presentation today. I really appreciate you taking the time.
No, definitely thank you. And okay, so say if I have patients and clients that I obviously will go ahead and, you know, suggest that they go and get this done. Well, is there a certain location that they go to, or can it be done at the office?
Yeah, we can talk about that after. We may be able to add your location because we do that quite often. We'll add a physician's location to our list of locations that we go to. But right now in your area, we actually utilize a company called Regis. Are you familiar with Regis?
Regis, yeah. It's they have many office have any businesses and offices, right? Is this a place where you can rent?
Correct. So in Tampa, we go to a Regis.
Which one's the one off of Fowler?
It's on 2202 Northwest Shore Boulevard, right by the airport.
Oh, which is good because I'm in Westchase, so West Shore is not too far from where I'm located.
Very nice. Yeah, so if anybody wants to make an appointment, they can visit our website. It's btiscan.com. That stands for Breast Thermography International. So it's btiscan.com. Or they can call our number. It's 877-315-7226, and we're at extension 447.
Okay, great.
Yeah, and Bradley, do you want to give the number to your clinic as well?
Yes, it's 855-633-4935.
Okay, so I see here on your site that's 855 Mediwell.
Correct. Is there any way I would be able to get like business cards or brochures from you guys?
Yes, definitely. We'll send you some. All right, well, Bradley, thank you so much. I'm just going to stop.